You're probably wondering why I'm linking an obscure 19th century German doctor with a contemporary social movement, Extinction Rebellion, which uses civil disobedience as a mechanism to compel action on climate change. And the reason is because Rudolf Virchow happens to be one of my role models. I've been inspired by him for many years. And so when I was asked to speak about climate change and health, naturally I thought, well, I'll speak about Rudolf Virchow. But there is a reason why these two topics are brought together. Now, I'm actually not going to speak about climate change. Climate change is a phenomenon that is natural and has actually been occurring ever since planet Earth came into existence 4.5 billion years ago. Rather, I'm going to speak about global warming and environmental degradation, which I think are terms that better describe what I want to focus on, which is the human activities that have been taking place, mainly in the post-industrial era, that is making our Earth increasingly unfit for human civilization. But let's go back to Virchow first. That's Extinction Rebellion, by the way. I expect everyone has seen Extinction Rebellion and read about it and possibly even been affected by this social movement. But Virchow, I first came across Virchow as a medical student when learning about Virchow's node. This is the eponymous enlarged lymph node that occurs above the left clavicle and which is a sign of gastric cancer. And there are actually lots of things that have been named in medicine that have been named after Virchow. He's been described as the father of modern pathology. He advanced the field of cellular pathology and helped to define and describe diseases like leukemia and thromboembolism. He coined all kinds of terms in medicine: amyloid degeneration, spina bifida, the term zoonosis, which describes the spread of infections between humans and animals. He's quite a big figure in medicine. He introduced hair analysis into forensic investigations, the first person to come up with a systematic method for doing a post-mortem autopsy. He was annoyingly clever. He wrote about botany, he wrote about archaeology, he wrote about anthropology. You'll be glad to know that he didn't get everything right. For example, he disagreed with Darwin and his theories of evolution. Primarily, I think, because he was afraid that those theories would be used for racist and eugenic purposes. But he gets more annoying because he was also a pioneer of public health. His study of the roundworm and the transmission of roundworm from contaminated pork kind of created the foundations for the routine inspection of meat by health inspectors. He helped to modernize the water, sewage, and sanitation systems of Berlin and was involved in the progressive healthcare reforms introduced in Germany by Bismarck. But the aspect of Virchow that I want to highlight concerns his famous contribution to a government commission that was set up to investigate a terrible typhus epidemic that occurred, a terrible and deadly typhus epidemic that occurred in the winter of 1847 in Upper Silesia. And it was Virchow's observation that this epidemic was occurring predominantly in people who were poor, undernourished, and living in squalid conditions that led him to conclude that the problem of typhus would not be solved by treating individuals, that it required population-wide improvements in diet, housing, and education. But in addition, and this is the critical point, Virchow argued that for that to happen, there needed to be political change. And in his report, Virchow talked about the need for full and unlimited democracy, the need for separation of church and state, the need for greater self-government, the need for a shift of the burden of tax away from the poor to the rich. So essentially what Virchow was doing, and he went further than that actually, he talked about the situation in Silesia, Upper Silesia, being shameful, and pointed his finger at the exploitation of the Catholic hierarchy and the big landowners, and pointed at the neglect of government, and described these as the fundamental causes of the typhus epidemic. So essentially what Virchow was doing was really framing justice, democracy, and progressive politics as a form of social medicine. Social medicine, it's a term that is very strongly associated with Rudolf Virchow. And for Virchow, it was absolutely logical for physicians to engage in politics. And in fact, he was expelled from the hospital that he worked in 1848 because of his participation in the revolution of 1848. And you'd be not surprised to learn that later on he was elected into the German parliament, into the Reichstag. And famously, he got into a fight with Bismarck over the size of Prussia's military budget, to the point that Bismarck actually challenged Virchow to a duel. Now, for me, I came to appreciate Virchow's connection of politics to health when I was working in South Africa. And it was clear to me as I was admitting and treating sick and starving African children on a daily basis in a country that was rich and abundant with food, that my patients weren't really victims of any disease, but they were really victims of apartheid, a racist, egregious, and oppressive ideology. And I also saw politics in health in the excessive prices of HIV medicines, which resulted in millions of Africans being denied an opportunity to live, with the root causes being, in my view, the greedy profiteering of pharmaceutical companies and a system that allows public investment in basic science to be turned into private profits. So the issue of pharmaceutical pricing and pharmaceutical research is probably a topic for another day. But let's go back to Virchow. When Virchow was doing his thing, the temperature of the Earth was 1 degree less than it currently is now. And the words climate change and global warming were probably not heard. However, if Virchow was alive today, I am pretty sure that he would be talking about how global warming and environmental degradation produce a whole variety of threats to public health, whether it be through the direct effects of extreme temperatures, and in particular heat, or extreme weather events, or sea level rise, or the effects of air pollution, or the even more deadly indirect effects of diminished food supplies, of loss of biodiversity, loss of fresh water supplies, the effects of mass population displacement, and the effects of wars and conflict as resources become increasingly diminished. And in fact, I suspect he would actually say that these effects are already catastrophic for some populations in the world. And furthermore, that this is a deeply unfair situation because, generally speaking, those populations that have contributed least to global warming happen to be those populations that are tending to suffer the most from its effects. He would agree with most scientists that we face an existential threat with global warming. And he would agree with most scientists that the kinds of targets and actions that we have in place to reduce greenhouse gas emissions simply do not match with the scale of threat that we face. It's almost as though we would be satisfied with a smoker who has diabetes and peripheral vascular disease cutting back from smoking 40 cigarettes a day to 30 cigarettes a day. Inadequate and pretty much hopeless. And like I think all of us, he would be perplexed why on earth are we not responding to what science is telling us? Why are so many governments simply looking the other way? Now, given his natural curiosity and his scientific inclinations, I suspect Virchow would want to be able to answer those questions himself. And I imagine that he would read the work of Naomi Oreskes and Eric Conway, whose book, Merchants of Doubt, provides a detailed and rigorous description of how the fossil fuel industry and other actors have been spending vast amounts of money to buy friends in high places and to undermine climate science, using many of the same tactics, the nasty tactics that the tobacco industry use to deny a link between smoking and lung cancer. I suspect, given that he was such an advocate for truth, that he would also want to dispel the false claims being made by companies like Exxon and Shell that they are shifting to renewable energy, when in fact they're investing billions of dollars into discovering and extracting ever greater amounts of fossil fuel. And I also suspect that he would not fall for the casual optimism of elites and technophiles who try and reassure us that this problem is a technical problem that can be solved with technical solutions and technology, as opposed to it being fundamentally a social and political problem requiring social and political solutions. So you can see where I'm going with this, yeah? In the same way that Virchow saw and understood the structural roots of the typhus epidemic in Silesia, I feel pretty certain that he would emphasize and see the structural, social and political roots of the global ecological crisis that we face. And while he would no doubt want to encourage all of us to try and be more sustainable in the way we eat and travel and consume, he would absolutely understand the limitations of appealing to individual conscience and individual behavioral change. Instead, he would be calling for transformative systemic change, change to our transport systems, our energy systems, our food systems, and also change to the prevailing ideology that we all live in, this ideology that makes a virtue out of crass material consumerism and overconsumption. This ideology that creates a kind of, that celebrates a human-centric worldview in which nature is treated as a commodity to be bought and sold. And I feel pretty certain that Virchow, were he alive today, would share in the fury of Greta Thunberg, her fury in the complicity of global leaders who are sustaining an out-of-control economic system that is producing unconscionable and eye-watering levels of inequality and environmental destruction. So what would Virchow say to other doctors and health workers were he alive today? So I reckon he would say three things. First thing he would say is, wake up. Wake up to the fact that there is a well-funded, well-organized program of misinformation and misdirection about environmental degradation and global warming. The second thing he would say, I think, would be use your voices. Use your voices as trusted members of society to inform, to educate, and to mobilize the community around this threat. Perhaps join an organization like MedAct. This is a charity that I used to head up, which was established by health workers, for health workers, to work on the structural, social, and political determinants of health. Amongst the many things that it does is to lobby health organizations, including, for example, the Wellcome Trust, the biggest philanthropic organization in Europe and a leading fund of health research, to stop investing in fossil fuel companies and to actually help remove their influence over society by joining the global divestment movement. And the third thing he would say, I think, is come and join me. Come and join me on Westminster Bridge as I try and block the traffic. Come and join me in following in the footsteps of Emily Pankhurst and Rosa Parks, and Nelson Mandela, and thousands of other people who have undertaken acts of civil disobedience to drive progressive social and political change. And for those of you who are not health workers, perhaps he might say, by applying a better politics as a form of social medicine, we are all health workers. Food for thought, hopefully nourishment for action. Thank you very much.